Armstrong. My name is Nurse Tally. I'm going to be taking care of you today. How you doing? Doing pretty good? Good. Okay. So today I am going to be taking your glucose level and then giving you some insulin, depending on how that is. But before we do that, can we start with your name and date of birth, please? Beautiful. Good. I'm also going to scan that in. Make sure that's good. Okie dokie. Okay, so before we get started, just want to know, how are you feeling generally today? Okay. Good. Good. Okay. Are there any allergies that I should be aware of before we take your glucose? Anything abnormal I should know about? Okay. All right. Perfect. So we're going to start with taking your glucose. I'm just going to get myself set up here. Getting all of my tools. Got my glucometer here. Okay. Alrighty. So, with my glucometer, I'm going to scan that it is you. Perfect. Matches. Okay, I'm also going to scan our strips. Perfect. So I'm just going to get myself set up here before we do the actual test. Set up here. Okay. Perfect. Okay, and so what I'm going to do before we actually get started is I'm going to sanitize you. Okay. Do you have a particular finger that you'd prefer? Middle one. Got it. Okay. I'm going to go ahead and sanitize that. We're going to let that sit for 30 seconds. Let it dry out. Okay. Perfect. Okay. Oh, you're feeling hungry. Okay, so we'll make sure we get this. That way we can go get you your food. Okay, so that's looking good. So what I'm going to do is I am going to take your needle now. Got your needle. Okay, I'm going to poke you. Ready? You're going to feel a slight pinch. I know you do this at home. Okay. Ready? And poke. I'll wipe off that first one. I'm going to there. We're going to get some blood. Perfect. Then we're going to put the blood on the glucometer. Oh. Okay, so it looks like you are 137, which is looking a little bit higher than we'd like. So I'm going to go ahead and give you some insulin before breakfast today, okay? All right. Okay, so what I'm going to do is I'm going to go ahead and get that set up for you. Yep, and for the next part, I will remember to put my gloves on because I forgot to do that. So I will make sure I have my gloves on for that. Okay, so beautiful. I will be right back. Your call-it is here. That is good. So I will be back. Okay. Going to the med room. Going to document Mr. Armstrong's blood sugar level. And I'm going to clean my hands again. I'm going to check our medication. So, Mr. Armstrong is getting 30 units of intermediate insulin and then 12 units of regular, which is what I have. Looks like I have Mr. Armstrong's name on here. Dosage is correct. Time of day for when we'll give it is correct. Right medication.
Expiration.
Oh, the expiration is also good. Perfect. Okay, concentration is also good. So we're going to start by roll the intermediate one. Okay. This is the cloudy medication. Ooh, don't drop it. Okay, I'm going to clean the top of the vial. And then I'm going to take my
Yeah, I think so.
Gotta unlock it. Take this off. So I'm going to start by pulling the air to inject 42 units into both cumulative bottles. Let's start with the cloudy one, which is the intermediate. Gonna poke it in without touching. I'm gonna push in 30 units. Perfect. I'm going to push in the 12 units of hair into the regular. Pull 12 units. Perfect. I have a nurse next to me, so I'm going to have her verify that that is 12 units.
Looks good.
Okay. And I'm going to pull 30 units of my intermediate insulin. It's going to total 42. Perfect. I'm going to have a nurse verify that that is 42.
Looks good.
Perfect. Okay. So then what I'm going to do is I'm going to safely cap this momentarily, and then I'm going to make sure I put Mr. Armstrong's name on it. It is still correct. It matches my NAR. And then I am going to go to his room and give this to him. So I'm going to wipe down my surfaces. All right, so now I'm going to go into Mr. Armstrong's room. Hello, Mr. Armstrong. Just going to take a moment and wipe down your table here. Making it clean. Okay. Set your insulin on the table for a moment. You ready for your insulin injection today, sir? Good. Before I give you your medication, I just want to verify your name and date of birth. Okay. I'm also going to scan you in. Triple checking. You don't have any allergies I need to know about in regards to your insulin or in general. Okay. So what I have for you today is your typical insulin dosage. So I have 30 units of your intermediate medication and then 12 units of your regular. Does that sound typical for you? That's what I saw in your MAR in your order. Okay, that's typical. Perfect. Okay, so I am going to be giving this injection to you either in your arm or your stomach. Do you have a preference? Okay, your stomach. Got it. Grab my scanning. So I'm going to go ahead and clean the area. Stomach here. I'm going to clean the area using a circular motion. Tickle a little bit. Sorry about that. Okay. Let that dry for a moment. Okay, so what I'm going to be giving you is your insulin. Okay, and that's going to help with your glucose level that we saw was a little high when I took it earlier, okay? All right, so what I'm going to be doing is injecting this into your stomach. Now give a little pinch, and then I'm going to inject the needle and then give you your medicine. And I have to hold it for 10 seconds, okay? It might be a little uncomfortable, but I know you do this at home, so. Okay, you ready? I'm just feeling, making sure the area is all good. It is. I'm going to pinch a little bit. Inject. I'll hold that there for a moment. Okay. I'm gonna safe release. Threw that away. I'm actually gonna put it on here. Is that in the trips box? Perfect. The area is looking really good and normal. How's that feeling? Typical. Got it. Good. Okay, so we'll go ahead and move that. All right. So that's really all I needed to do for this morning. I'm going to be coming back after you have breakfast, and we'll reassess, see how you're feeling. Do you have any questions for me today about what we did or what to expect, anything like that? No? Okay, so I'm going to just document what we saw each other, and I'll be seeing you later. Okay. Bed's looking good. Okay, still got your call light. All right. Bye, Mr. Armstrong.